I've got friends. I mean, I've got friends who've literally just come back from Gran Canaria and were at Gran Canaria Pride, and they're kind of calling me up and saying, "Well, I'm nervous. I'm nervous. There's all these cases." So, what are the symptoms of monkeypox which they should be looking out for? And if they get those symptoms, what should they be doing about it?
So the classical symptoms are an unusual particular rash. Traditionally, people are supposed to have what we call a prodrome, so symptoms of a virus infection beforehand. But in the presentation of the cases that we've seen, particularly clustered in London, that hasn't been the case. So if you don't get a fever or lymph nodes or feeling generally unwell, then that doesn't exclude you from having monkeypox. The classical rash is a bumpy rash, which basically looks like bumps with liquid, clear liquid in, and that can be anywhere, traditionally on the face first, and then later on other parts of the body, including the genitals.
Right. And if someone's got that rash, what do they do then?
So the first thing they should do is go to ring their sexual health clinic, and most sexual health clinics now have a pathway which will allow people to get in very quickly, so we can assess you and see if you do indeed have monkeypox or some other infection. Obviously, we want people to call us because there's a possibility they could have another STI like herpes or syphilis, and we'd need to see them fairly quickly to sort that out. If it's out of hours, then you ring NHS 11. And if you want to ring your GP and you don't want to go to the sexual health service, you can also ring your GP.
And Claire, are people living with HIV who contract monkeypox at any greater risk of serious illness?
So the understanding that we have at the moment is that if you have a normal immune system, so your CD4 count is above 200 and you contract monkeypox whilst living with HIV, you are not at any particular great risk of becoming more significantly unwell. But we do want people to obviously inform their regular doctors, so in particular the people that look after their HIV care on a regular basis if they think they have symptoms of monkeypox. So it'd be more the people that we would worry about is people who have low CD4 counts.
Right. And is there a connection? I mean, you talk about low CD4 counts, but what about viral suppression? I mean, does that make a difference, do you think, in terms of risk of severe illness?
So there's very little in the way of understanding about this because there's very little data. So all the cases that have been looked at where people living with HIV have acquired monkeypox have been people who haven't been on treatment and they haven't had access to treatment. So it's hard to be certain. The take that I think we're taking and Beaver seem to be taking the same approach. The British HIV Association seem to be taking the same approach. And that is that if you've got an undetectable viral load and your immune system is restored to some degree, then you're less likely to become ill with it.
Yeah, I mean, I think it's always really important to consider viral suppression as well as CD4 count, just because a lot of us aren't having our CD4 counts measured at the moment.
No, exactly. Yeah.
So now we know that they're starting to roll out the smallpox vaccination for healthcare providers. But there have been concerns around the smallpox vaccination in the past that actually there is a small risk attached to it, and particularly for people with compromised immunity. Do we know whether, I mean, if you were living with HIV and you were offered the smallpox vaccine, should you take it?
Yes, I would say you should take it. So as a general rule, again, if you are on treatment, your viral load suppressed and your CD4 count is good, then you're going to be perfectly fine with the current smallpox vaccine. That's what we're recommending. So we definitely think if you have any concerns about that and you're offered it, that you should definitely contact your regular doctor. That's the advice that the virologists are giving us at the moment. And personally, that's the advice I'll be giving to patients I see in clinic.
And
Right.
what about pregnant women living with HIV? Are they at any greater risk if they contract monkeypox?
Yes, so we're postulating, although again, we don't have a great deal of numbers, that you potentially could be at greater risk. And the approach to you having vaccine may well be different. As far as I'm aware, there haven't been guidelines drawn up about that yet. So if you're pregnant, you're living with HIV, and you think you might be at risk of monkeypox virus, either because you've been with somebody who had it or you've got a close household contact with it, then you should definitely speak to your clinic about whether that's going to be useful for you. At the moment, my understanding is that we don't really know. I would imagine that we'll start collecting some data about pregnant women, and then we'll be able to, as we go, make some decisions.
All right. And the final question. I mean, as we've seen with COVID, I mean, one of the challenges of dealing with new emerging infections in the modern era is the level of misinformation. So what's the most reliable sources of information that people can go to if they want to have more information about monkeypox?
Well, I would say this, but it's probably currently the British Association for Sexual Health and HIV website, because we're updating on a daily basis, and the British HIV Association website, because we're trying to make sure what's most important is that the information that gets out isn't stigmatizing people, and isn't making people reluctant to access care, or they don't identify as potentially being at risk and therefore they don't access care. So we're putting out as much broad information as we can, so that if people aren't sure whether it's about them or not, those are the places to go. We've got a specific monkeypox section on our website, and people can access that even if they're not healthcare professionals.